Hello to those who are joining us today in this new edition of the show. We are in this together. As always, we thank you for your sympathy and also to join us in this edition. Today, we are also inviting Pedro Porrino, the Dr. Pedro Porrino, epidemiologist who is part of the International Federation of Red Cross represent America's office here in Panama. And today we wanted to discuss with him an overview about the situation of the pandemic in the Americas. Welcome, Pedro, and thank you for accepting this invitation.
No, thank you very much. Thanks to you. As always, an honor and a pleasure to be with you.
Last week, we talked about the vaccines, and we had a great reception from those who follow us, asking questions and also commenting on what you said during that show. But today, we wanted to know more about the pandemic in the Americas. How is the situation right now?
Okay, well, actually, yes, we have been living with this pandemic for almost 10 months. So yes, how is the situation now? Well, I mean, yes, the pandemic is following a very clear pattern that actually is very similar to how the pandemic has evolved and is evolving in other regions in the world. Actually, if you look at the epidemiological cards, then yes, you can see that in the Americas region, we are almost following the same trend, the same pattern, just followed by MENA region or by Europe region. And how is that? That is that, okay, yes, we lived a high, fast increase in the number of cases, obviously, just as far as the virus started to circulate among the communities. So yes, we got very fast community transmission, and then just a high increase, a fast increase in number of cases reported. Then in the region, actually, that just a steady high increase 1 week after another week lasted for almost 6 months. That was much longer than any other region in the world. That is true that also just we need to say that was led by North America, obviously because of the number of people living in the United States of America. And then we reached like the peak of the, let's say, we will talk a little bit later about the first wave, yes, reaching the peak around mid-July. Then we started a downward trend with, let's say, discrete decrease of cases reported every week, but as we could anticipate, that didn't last too much. And after just 4 or 5 weeks, we are again in a clear upward trend. Actually, yes, we have surpassed the number of cases reported weekly down even at the worst moment or the worst week during the first phase of the pandemic in terms of cases reported. Fortunately, not in terms of death reported. And that is because there are several factors that we will talk about just to understand and to interpret how just or why we have so many cases now, and how can we compare that with the situation in April or May, June.
Thank you, Pedro. What is the Americas registering so highest number? Since the beginning of the pandemic here in the region, we've seen a lot of cases here. What is the reason why?
Well, the first reason is quite obvious. Is obviously the more people, the more population you have in an area, the more cases you report, right? So the Americas region is is gathering a lot, a high percentage of the world population, right? So that means that obviously, as I said, even if you compare across different sub-regions within the Americas region, and you look at absolute figures, then just United States is leading by far the number of cases, but for obvious reasons. If you have 500 million population in one country, obviously you will report many more cases from there. Another factor is that it's true that we need to look at how strict or how well implemented have been the measures of the public health and social measures. So just that probably has varies widely across the region. And secondly, we need to take into consideration that when we talk about cases, we are talking about cases officially reported. I mean, just the cases that each country is reporting through their epidemiological surveillance systems. Why I highlight that? Because it depends a lot on the capacity to test and to report. These figures will be less or more. Actually, I remember perfectly when when this started, and then just Europe experienced a high increase of cases, the MENA region, the Middle East region experienced a very high increase in cases, and Americas started to report a huge amount of new cases per day, per week. Also, everyone was very expecting and very alarming and very concerned to see how that was evolving in the Africa continent. Why? Because we said, well, the health systems are weak. Unfortunately, there are many countries in Africa with weak health system, also with weak surveillance, epidemiological surveillance systems. So we were anticipating in somehow that it was a huge crisis there, and we were going to start to receive very, very alarming figures from Africa. That has not happened. I mean, in terms of the figures, right? Also, for sure, there are some different factors, for instance, related to the age distribution of the population. We said and we knew that obviously this is a disease that is very linked, the severity of the clinical evolution is very, very, very linked to the age and to the underlying conditions. So yes, obviously in those areas where we have an aged population, yes, we will see more cases and more severity. So there are many factors, and now also just we will talk about just why now we are seeing more cases than before. But I will wait for likely the question on that, right? What is going now in comparison with what was going 2 months ago?
Pedro, we had heard from Europe that this region is experiencing a second wave. What does that mean?
Okay, so actually, Diana, I can tell you that there is still a kind of discussion, a theoretical discussion about whether or not we can call this a second wave or is the same wave but with different factors, right? So the issue is that this second wave is caused, let's say that, okay, we agree that we can call second wave. regardless, technically is more or less precise, right? But I mean, if you look at the epidemiological curve, you can see clearly a first just wave or hill, and then just we are again just in a new hill or in a new wave, right? So why this? Obviously, for me, there are clearly two reasons. First is that we put a lot of social measures, public health measures to control the first wave, just the high increase of cases during the first month of the pandemic, and it worked because it had to work. We limited a lot the interaction. Actually, yes, we put more than 50% of the world population on lockdown. That has been the first time in the history that we have put so many people in lockdown, right? So obviously, the more you limit the interaction of people, the more you control the transmission. But obviously that cannot last forever, because we actually know how many secondary impact and how many indirect impact also we are getting from that measures, right? And just because of that, we need to be very careful and to put in the balance, obviously, the measure to control COVID-19 transmission, but also not putting in a high risk population because of the effect of that, right? So, but at the end of the day, we control the transmission, we reduce the transmission. As far as we reduce the transmission with this measure, the number of cases started to decrease. So that conform or shape the first wave out, okay? When we control the transmission, when the cases started to decrease, we had to retake our life in somehow, the social interaction, the people had to go back to work, at least those who fortunately could keep their work. And also just we started the interaction. So obviously the virus is there. The virus won't go anywhere till we control finally the transmission whenever the vaccine is ready to be distributed. So when we started to have interaction, the virus started to circulate again. And then we started to have more cases because people started to get in touch with the virus again. But when you look at the wave, at the second wave that we are living now, you can see that just in 2 weeks in the Americas, I'm talking about the Americas region, in 2 weeks, we have already surpassed the tallest or the highest peaks of the first wave. I mean, we have surpassed in 2 weeks the number of cases that we were reporting as the highest number in the first wave. Is because the transmission is much more than before? Is because people started, I don't know, to actively transmit the virus? Is because the virus is more virulent than before? No. The explanation is that now we are able and we are actively looking for cases, identifying cases. And I think that this is a very, very, very important and crucial message that we need to give. There is no more transmission. The virus has not changed and is affecting more people. What we cannot, and just because of that, I'm a little bit reluctant to talk about waves, is because we cannot compare the epidemiological surveillance we are doing now with the epidemiological surveillance that we were able to do at the beginning. Just an example, and everyone here just can remember when even at the beginning of the pandemic, the messages were only if you are very sick, go to the health center, go to the hospital. if you are just experiencing some symptoms, but you are not having any alarm sign or danger sign, stay at home, just don't interact with people, and don't go to the health center because they are saturated and can be much worse than stay at home. Obviously, those days, all these people who were not seeking medical care were not tested. Therefore, they were not reported as cases. All these cases were not reported. The figures that we were reporting at the beginning of the pandemic were people who had to go to the hospital, who had to go to the health center. Nowadays, we are testing, even we are conducting a massive testing campaign, testing people in the neighborhood, even people with no symptoms at all. Just because of that, now we say, well, we are identifying, even there are some figures saying that 80% of cases are asymptomatic. Well, it's because now we are testing people. So just we know that there are many people who are not developing symptoms, and now they are being reported as cases. So there are more cases than before? Likely no. What we are doing is that we have the capacity to identify and to report many more cases than before.
Pedro, I wanted to change a bit the topic. Well, it's related, of course, but as we know, the Americas is an endemic continent with dengue, for example. And we wanted to, because part of the America is still under the raining season, but we wanted to know about the dengue situation right now.
Well, thank you very much. As you said, Diana, we are talking about COVID-19, but there are many more health problems, not only in addition to COVID-19, but aggravated by COVID-19. And this is also just very important. It's not just we put like a stand-alone problems, one another, one beside another. No, they are just working together to create higher and more severe health problems. And dengue is a clear example. Why? Because different reasons. First, because obviously COVID-19, like many other health services, the surveillance for dengue has been affected by COVID-19. You know, so just we usually like to highlight just how the disruption of essential health services and the disruption of some epidemiological surveillance for other diseases can bring really for some issues even more morbidity and mortality than COVID-19 itself. For instance, immunization, but this is something that maybe we can just talk another day. Mm-hmm. But for dengue, it's like there were many resources put on dengue surveillance. Dengue is an infectious disease, is a communicable disease that we need just to look at, we need to monitor, and there are just dengue epidemiological surveillance system. Many of the resources that were allocated for dengue in some areas, in many cases, have been, if not totally, but partially have been put on COVID-19 to address and to tackle the emergency. That means that now we are not monitoring dengue cases as before. We have not the same capacity to detect and to identify dengue cases just like before. And we are not able just to put in place just as timely as before and needed just the measure to control that. So in dengue is especially important because it's one of the most prevalent and endemic disease in the area. worldwide, there are 500 million of people living in dengue-prone and endemic areas of dengue. So yes, it's a clear example that how the shift of resources and to put the focus on COVID-19 may be weakening the surveillance and the attention put to other diseases.
Following up with the dengue question, have there been cases of cross-contamination dengue COVID in the region?
Well, I mean, it's not cross-infection or cross-contamination, but co-infection. So yes,
okay.
We have identified just cases and we have seen person suffering from both diseases, from COVID-19 and from dengue, because they are living in a dengue endemic area. So just they are exposed to COVID-19 and they are exposed to dengue. Obviously, just for research purposes, this has been a study and you know, just because not only, especially to determine whether or not the co-infection with dengue, like other pathologies, may be posing an increased risk of a high severity in the medical condition for both, for dengue and for COVID-19. There are not clear results, but it may be that obviously the two infections may be working together to produce a higher severity of clinical course. But what is also very important, I would like just to highlight that is that what is true that we have seen, and I think that that is something that we need to take in mind, is that when we have a context of COVID-19, obviously the natural trend is first to address COVID-19. And what it has happened, we know that has happened, is that, okay, you may start to develop both symptoms of COVID-19 and symptoms of dengue. Actually, just the initial symptoms can be quite common. Fever, some just pain, general pain. So you go to the health center, right? Obviously, now we have like the focus on COVID-19. So just that, what could happen is that you are tested for COVID-19 and you are positive. And that may, what may happen is that after the first diagnosis of COVID-19, nobody's going to keep looking for another disease like dengue. And then just you are sent back home with COVID-19 diagnosis, with some just message about how to protect yourself and protect the people living with you, and even just with some sign alarm or alarm sign for COVID-19. But maybe you have not been tested for dengue, and so you may not be just you cannot be treated, or they have missed an important diagnosis that it should be there in order to treat you, not only for COVID-19, but also just to follow in case that you may start to develop just dengue with alarm sign, and you are at risk of developing a severe dengue. So just both pathology, but nowadays we are very focused on COVID-19, and just because of that, we may be missing other diagnoses that are just as important as COVID-19.
Pedro, we are now in the 9th month of the pandemic, almost 10 months of the pandemic. What are the recommendations for the region after 9, more or less 10 months?
Well, the recommendations are quite similar to the recommendation that we have been doing since the very beginning, because unfortunately there are not major changes making our advices or our recommendation different than before. Because till we don't have the vaccine, because till, as we were just saying last week, till we don't have between 70 and 80% of the population with immunization, with immunity to COVID-19, the transmission will be there. So just if the transmission is there, we need to protect ourselves, and we need to protect others with the only measure that we know that work. That is just to try to keep the physical distance of at least 2 meters when we are just, especially in close spaces where we are with people who we don't live together, right? To use face mask and to hand wash and to extreme the hygiene and the hand washing. These are the measure, the individual protective measure that we have to follow always, because also it's a way to protect others. And of course, to follow, I know that sometimes it's very difficult, and we have discussed a little bit already about that, about the pandemic fatigue. I fully understand that people after 10 months can be wondering, why should I keep doing this? Why should I have to use face mask? Or why just I have to be on quarantine only because somebody says that whoever I met yesterday is positive? Or why should I isolate myself while I am waiting for a COVID-19 result? I know that is quite difficult, but it's the only way that we have also to protect other people, especially the most vulnerable, and we have all just a kind of social responsibility that we need just to take into consideration till we can control definitively the transmission, basically by a vaccination campaign.
Thank you very much, Pedro, for the interesting information you have shared with us today. And we want also to thank those that have joined us in this transmission and are connecting with our social media channel. We invite you to continue connecting with us, because we are going to be sharing more information doing this video show or live show that we are starting last week. And in Spanish, we resumed last week, but we have been doing this show since the beginning of the pandemic in March. And we also wanted to invite you to share your doubts, questions, and comment using the comment section in this channel. Thank you very much again, Pedro, for being with us today.
My pleasure. Thank you.